Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, man, we're really excited to have you here because we're just bringing some very exciting conversations with some incredible leaders that are painstakingly reshaping the future of healthcare. We're passionate about a few different areas. We're passionate about healthcare innovation, access, and leadership. And if it's your first time tuning in, let me just take a very quick step back and just tell you a little bit more about what we're doing here. So we're focused on bringing real stories of innovation to life. The aim is highlighting real people that are actually getting stuff done within our space and just giving them the opportunity to share the learnings, share the little wins, and their stories with our community and ultimately with the world. So we've got just an amazing action-packed year. If you haven't had the opportunity to check out any of our historical interviews, however you're consuming this, if you're watching it, if you're listening to it, just hit the subscribe button now so any new interviews come directly to you. So today's guest is someone who doesn't just talk about transforming healthcare. He builds the infrastructure to make it real. Dr. William Paiva is a very rare kind of leader, equal parts scientist, venture capitalist, and a systems thinker. So, as the managing partner of the Oklahoma Life Science Fund and executive director of the Center for Health Systems Innovation at Oklahoma State University, his work really sits at the intersection of innovation and impact, and just particularly just in rural and underserved communities. And he spent his entire career, unlocking value where others really often overlook it. Whether it's guiding early stage companies, empowering rural providers, and using data as a lever to bend the arc of healthcare towards access and equity. So, in a world that's really, it's overwhelmed by buzzwords, Dr. Pava is really focused on results, lower costs, better care, stronger systems. So he understands that innovation doesn't just happen in a vacuum. It's born from proximity to the problem and partnership with those that are on the front lines. So this conversation is long overdue, in my opinion. So we're going to go deep into how venture capital, data science, and community-driven care models kind of all intersect and can redefine what's possible within our healthcare system. So, Dr. Paiva, welcome to the show. It's great to see you.
Wow, fantastic. I just wish my mother was on this call to hear that just beautiful introduction of me. So thank you.
Oh, it's my pleasure. Truth be told, I really try to do a good job when I introduce people because
Well,
I
no,
just
you
imagine
mission
myself being
accomplished.
introduced. So we're off on a good start. So it's amazing. So let's go back to a moment that doesn't show up on your LinkedIn.
Mhm.
What is the kind of a quiet decision that changed the entire arc of your career?
Oh, wow. Great. I would say really two things. If I can answer with two answers. The first would be when my parents made the decision to come to America to raise me in America. And I was born in Germany. My mother was German. My father was Portuguese, Hawaiian. And they made a decision when I was two and my brother was three to come to America to raise their children in America. I would think that was be the most impactful inflection point of my life. I would say the second is when I made the decision to leave the lab from from a traditional lab scientist standpoint as a molecular biologist, neurobiologist, and go to business school to get on the business side of science
Hmm.
and really focus on the application of science. I would say that would probably be the second most transformative. I would say one personally and the second professionally, but they're both linked together.
I'm curious, what was that inflection point, that pulled you from the lab to go down that track? Was there anything in particular that really drew you to it?
Yeah, I think it was really, to be an effective scientist, you have to kind of pick one area of science, whether it's a protein, an enzymatic pathway, or whatever, right? And you spend the next 30 to 40 years of your life really diving deep and going
Yeah.
down the rabbit hole of that particular area. And along that journey, if you're fortunate enough that that actually creates intellectual property that's got commercial value, then you have some humanity benefit for the science. Not that science in and of itself doesn't have humanity benefit, but as far as the applicable humanity benefit. So, I was sitting there looking at that and thinking, well, I could do that, or what I could do is go to business school, get on the business side of science, and help sort of a broad range of people translate their innovation, technology, and science into solutions that actually get implemented to solve real world problems and our
Mhm.
most vexing healthcare challenges. So it was really that desire to just have a bigger, broader impact and felt like I could be the go-between between science and scientists in
Mm.
the market.
That's brilliant. I just remember one of our sort of sidebar conversations. You were sharing a story. By the way, you're a pretty awesome storyteller about advice that
Hmm.
you were giving students uh, while you were on a panel. And it kind of got me thinking because you talk about little wins and maybe like awe moments. Like who held the door open for you? When you think about access, you think about just little things that make big differences. Who held the door open for you, figuratively? And I mean, maybe who are you holding the door open for now?
A great question. Literally, it goes back to the two moments in my time. The first would be my parents who held the door open for me to come to America, which I passionately believe is the greatest country in the world and has been that way for hundreds of years, and hopefully will continue to be that, right? And there's no greater time to be an American citizen than to be an American and to be an American citizen right now. And so my parents
Mhm.
opened that door for me first. The second would be my PhD advisor when I went to him and said to him, Philip, I was like, look, I love science. I love what we're doing here, but I think there's something bigger out there, different for me on the applied side that I want to go do. And he embraced that. He embraced that in a time when it wasn't really accepted for scientists to leave the lab, if you will,
Yeah,
right? Back when I was doing my PhD in the mid 90s, if you left academic science and went to go work at Merck or Pfizer as an industrial scientist, you were considered a charlatan because you were now selling out, right, to the
yeah.
almighty profit motive of science, right? And so you were to a certain extent a sellout, right? I was actually doing even one step further beyond that. Not only was I not going to become, an academic scientist to an industrial scientist, I was going to jump even one step even over that and go from academic to past industrial science to actually be a business person to actually go commercialize that. And I think it was Philip's embracing of that with me that was a big moment for me in opening the door that I forever am grateful to him. And actually, at the time, I
Mm.
was debating whether to go to law school or medical school. And he actually told me to take time out of my PhD program at that time to actually go do internships at a law firm and at a small biopharma company and just kind of figure out what I wanted to do. And I mean, think about the grace
Yeah.
that and generosity he extended to me. And so I went and did a internship at a law firm. I did an internship at a small biopharma company. And at the end of that, I decided I didn't want to go to law school. I wanted to go to business school. And it was that moment in time that was just, a pivotal door opener for me. And I'm forever
Mm.
grateful for it. And yeah.
That's
And
phenomenal.
in
That's
terms to answer
amazing.
the second question you just asked,
Yeah.
which was and oh, by the way, Philip, the other thing, Philip I was telling him, I was like, Philip, I'm thinking about going to business school. And so at the time I'd done my PhD at the University of Oklahoma. And so I said, well, maybe I'll go back to OU or, Oklahoma State or the University of Tulsa to get an MBA. And maybe if I swung for the fences, I'd go to the University of Texas or something like that, right, to get an MBA. And Philip was like, no, 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 you're going to go to the Ivy Leagues to get an MBA. We're not doing that. If you're going to do it, let's go do it. Right. And I was like, Philip, I can't afford it. Right. I literally can't afford to go get an MBA from a Ivy League school. And he's like, you honestly can't afford not to do that. Right. And because if you're going to do it, go do
Mm.
it. Right. And,
What an
and,
interesting
and
perspective.
yeah. And he said, and so I did that and it was transformative. He was so right on all of the levels. Right. And so you asked the second question, which I never answered, which is how do I actually return that back? In the course of 25 years of being a venture capitalist, I have run an internship program that's actually funded by a grant I get from a local granting agency called the Oklahoma Center for Advancement of Science and Technology, and it's an internship program. And they match half the money for the internship, and I match the other half personally. And over the course of those 25 years, I don't remember the exact numbers, but this will be directionally correct. I would say over the course of those 25 years, I've had about 14 or 15 interns that have worked for me. And of the 14 or 15, I want to say last time I looked, six of them went to Harvard Business School, two went to Stanford Law School, two were Rhodes Scholar finalists, one was a Marshall Scholar. Um, one ended up going to Harvard, actually stayed in science and went to Harvard and got his PhD in genetics. And so in terms of flipping that the other way, that's what I've done to kind of
Mm.
flip that back. And when I actually recruit these kids, these interns, I look for the PSM kids because in my experience, the PSM kids have
PSM?
done so yes, the PSM kids, Michael, the PSM kids are the ones who have just done so well in my life, in my journey. I saw them at JP Morgan. I saw them at Merck. I saw them in my career as a venture capitalist funding entrepreneurs. The PSMs are the ones you want to go support, right, Michael? In the
Yes.
PSM, poor, smart, and motivated. Those are the kids that I go find.
Yes.
So
Yes.
what I
Yes.
look for are the same ones that I was, right? My dad was a mechanic. My mom worked in the school cafeteria, right? And what the journey I went on and Philip's guidance and going to getting my Dartmouth MBA, what I really learned was the arc of what all is out there in life to go do. So it's been passionate for me to go find these poor, smart, motivated kids. And the same conversation I had with Philip I've had multiple times with each and every one of them when they were talking about what they wanted to go do. And they would tell me like, yeah, these are National Merit Scholar kids, super bright, super motivated, right? And but poor upbringings, right? And don't
Mm.
really have the visibility of what all is out there in the world to go do. And I would have the same conversation that Philip had with me. I was like, you can't afford not to go to Harvard. You can't afford not to go to Dartmouth or Stanford or yes, let's go apply to be a Rhodes Scholar. Why not, right? And two were Rhodes Scholar finalists. One ultimately got the Marshall Scholarship. I mean, it's been a and so yes, that's the flip side of how I've returned back from what Philip was able to inure to me.
That's brilliant. That's brilliant. So let's maybe shift from your personal
Sure.
arc to maybe the systems that you now influence, specifically how rural health kind of really became the canvas. I mean, you've
Mhm.
said rural health isn't, it's not a place, it's a perspective. I mean, what does that perspective reveal that most of Silicon Valley and Washington still miss?
Yeah. So roll back in time. So one of my investors in my venture fund is the founder and founding CEO of Cerner Corporation, the large electronic medical record company in Kansas City, Neil Patterson. And Neil grew up in Oklahoma, in Manchester, Oklahoma, population 118, right on the border of Oklahoma and Kansas. And this sounds like a Hollywood script, but Main Street is really the state line between Oklahoma and Kansas. And there's one red light in the middle of town that blinks, right? And so it's in the middle of nowhere. I mean, it is super rural, right? And he grew up there. Then he went to Oklahoma State University, got a degree in accounting, moved to Kansas City, worked in public accounting at Arthur Andersen, and then 3 years later founded Cerner Corporation. And so he's like Cerner's one and only CEO until he passed away of cancer complications. He wanted to get back to Oklahoma State University. And as part of that, he gave money back to Oklahoma State University and asked me to go on the board of this center called the Center for Health Systems Innovation. And I did that for about a year. And then we decided to actually restructure it and go after a different mandate. And so I
Mm,
spent some time working with Neil on this and with the team, and we ended up focusing on rural and Native American health. Well, how did we end
mhm,
up there? Well, at that time, I'm, let's say, 15 years, almost 20 years into my venture capital career, and I've backed entrepreneurs throughout that entire time. All of them focused on
mhm,
urban healthcare. Well, why do we focus on urban healthcare? It's the same reason Willie Sutton robbed banks, right? It's where the
mhm,
people and money are, right? And consequently, rural medicine gets overlooked, right? And
mhm.
20%, we love talking health disparities.
Right.
Every community has a health disparity, whether it's inner city, suburbia, whether it's the north part of their town and the south part, or east versus west, whatever it is, but everybody has their own health disparity. The reality is rural medicine is America's largest health disparity. 20% of America, 75 million Americans live in rural America dealing with inadequate health care.
Mm,
And if you look at the actual data about the average life expectancy for a rural citizen, apples to their urban counterpart, is about 7 to 8 years lower life expectancy than their urban counterpart. And by the way, Michael, you see some extreme examples of this, right? If you look at Stillwell, Oklahoma, There was a Washington Post article about 5 years ago where a reporter for the Washington Post set out to actually see if where is America's lowest life expectancy in the entire United States. So he went across the entire United States. Turns out it's Stillwell, Oklahoma. Okay. If I told you the life expectancy in America is 78 for men and 79 for women, which is roughly correct, right? 78 men, 79 women. What do you think the life expectancy in Stillwell, Oklahoma is?
60.
55. 55 is the life expectancy in
Wow.
Stillwell, Oklahoma. It's the lowest life expectancy in the entire United States. It's actually lower than the sub-Saharan desert in terms of life expectancy. It's about
Wow.
20 or 25 or so years lower than life. So you see some extreme examples in rural medicine of life expectancy challenges. And so we decided to point our headlamp, if you will, or our true north at how do we actually focus on rural and Native American health. We loop Native American health in because the Venn diagram between rural and Native American is pretty high, right? And we're in Oklahoma, largely a rural state. Oklahoma State University
Hmm.
is a land grant university. And so for all those reasons, we decided to focus on rural medicine. Well, what does that mean? We're going to focus on rural medicine because you can't boil the ocean. I know that from venture capital, right? So you got to be
Yeah.
focused. And so what we decided to do is really focus in two areas. One is the significant understaff, talk about access, the significant understaffing of primary care and rural medicine, right? So for instance, in Oklahoma, um, if you just simply look at the numbers, if you wanted to get to the national average in terms of rural docs per rural citizen, right now we have about 880 rural primary care docs in America, in Oklahoma. If we
Hmm.
wanted to get to average, forget about exceptional. If we just wanted to get to average, we would have to get to 2,000 rural primary care docs. So we're about uh,
Wow.
60% lower than where we actually need to be in turn just to get to average. That's not even exceptional, right? That's
Yeah.
just average
Yeah.
coverage, right? So significantly understaffed in primary care in rural. The second is, and I call this the lack of ologist, almost a complete absence of subspecialists, right? There are no pick your favorite ologist. There's no cardiologist, neurologist, oncologist, nephrologist, ophthalmologist. Just pick your
Yeah.
ologist. They're just not there, right? And so the second part we focus on is how do we actually build subspecialty capacity in rural? So in both cases, what we're trying to do is how do we actually build rural primary care coverage and how do we actually build rural subspecialty coverage without adding humans? Because all the other prior objectives has been, okay, let's give them tuition incentives. Let's recruit
Yeah.
rural kids to go to medical school and hope they go back. We've been doing those for decades. They have marginal benefits, right? So we said, keep doing that, university. We're going to focus on how do we actually augment and complement and build rural primary care capacity and rural subspecialty capacity without adding humans, which means what we look at is workflow improvements, care models, technology layers. That's where we're
Mm.
focused on.
But you've seen a lot of smart ideas fail.
Yeah.
I'm just sort of curious, what is the common thread that founders miss when even just trying to serve rural health?
Yeah. I mean, a lot of founders, okay, let's come back to that topic. Okay, I'm going to answer the
Okay.
question and then we're going to come full circle. Okay.
Yeah.
A lot of entrepreneurs avoid rural, right? For
Yeah.
obvious reasons. It's fragmented, it's your sales channels costs are expensive, your payers are Medicare and Medicaid and uninsured, right? So it's not the most attractive patient population to go after in terms of reimbursement. So for all those reasons, entrepreneurs don't typically focus in rural medicine or going after rural, right? But I'm going to hopefully at the end of this change your mind on that topic. And every entrepreneur out there, hopefully you'll hear this and change your mind on rural. So one of the very first things when we did is we said, okay, that's our strategy, rural primary care, rural subspecialty. How do we build capacity? So now the next question is, okay, once again, we're not going to boil the ocean. What are we actually going to do specifically within that, right? And the first thing we did is we went out and surveyed about 250 rural providers and asked them where their major unmet needs were, right?
Mm.
And And we surveyed doctors, we surveyed office managers, we surveyed nurses, we surveyed community health workers. We went all over the board, right? And just to sort of do this structured methodology for both structured and unstructured results to figure out where the major challenges were. Because as a venture capitalist and entrepreneur, one of the things I say about entrepreneurs is the great thing about entrepreneurs, and I think consider myself as an entrepreneur, as a venture capitalist. The great thing about entrepreneurs is, or not great thing, sometimes the problem with entrepreneurs is they discover solutions for problems that don't exist, right? So I was like, okay, let's go figure out what
Facts.
the problems are, right? So I would say back to your very first question, the reason a lot of entrepreneurs have missed the mark is I think they kind of look at the world through urban lenses, right? And they
Mm,
say, okay, well, these are solutions that we see in the urban market, and therefore let's just push them into rural, right? Not really realizing how different care is being delivered in the rural market, right?
yeah.
And so
Right.
that's the first mistake that they make, right? The second is, and I need to write this editorial. I'm going to call it the Maslow's hierarchy of rural healthcare needs, right?
You're
Our
doing it right
healthcare,
now. You're doing it right now.
we're doing it orally, yes. The urban healthcare needs, we have high class healthcare problems in urban America, right? And we have great technologies to address many of those. But like if you look at rural markets, and this came out of our survey, the number one challenge in rural medicine for a rural primary care doctor and rural providers and even rural patients is getting them to their appointments. Literally scheduling, logistics, and transportation. Literally just physically getting them to their appointments,
Yeah.
right? And
Yeah.
it's a multivariate problem, right? It's do they have adequate transportation? Many of them are hourly employees. You and I are salaried employees. So if we take a half a day off to go to the doctor, it doesn't affect our take home pay. If I'm an hourly employee and I take a half a day to go to the doctor's office, that's a half a day of wages and I'm living paycheck to paycheck already, right? So there's scheduling, there's logistics, there's transportation. Many of them don't have caregivers to support them while they go and get care, or if they've got,
Mm,
if all those sorts of reasons. The no-show rates in rural medicine right now are, in some of our survey results, are about 18 or so percent no-show rates. And in the urban
wow.
markets, it's around 6%, right? Can you imagine trying to run a business where you schedule a business and 20% of the time nobody shows up, right?
Yeah.
So one of the programs we
Not a
did,
winning recipe.
yeah, no. So one of the programs we did, but nobody in urban thinks about that as an urban entrepreneur because we got all these high class technologies we want to deliver. But the number one challenge is scheduling, logistics, and transportation, literally just getting people to their appointments, right? So we actually launched a program where we funded through our innovation center a cab who would pick up people and bring them to their appointment if they didn't have adequate transportation. And we reduced the no-show rates down from, 14 or so percent down to about 6 or 8% in that marketplace. We
Just
basically
a
built
regular
10,
cab, or is it like a non-emergency medical transportation type of network?
just straight cab right now. It's not an NEMT. We were just doing it with a regular cab, right?
Hmm.
And just getting people to show up for their appointments. And we were able to reduce the no-show rates by about 10%, which said differently, we were actually able to build clinical capacity of 10% with really doing nothing other than providing transportation. I funded it through my innovation center and I would fund the transport costs, right? Because I knew it would work. And we were collecting all the metrics. We were looking at what it actually meant to the primary care doc in terms of boosting of their
Right.
revenue.
Hmm.
And we were able to demonstrate to this three physician clinic that we would boost their income, all three of them, by offering this service, even if they paid for it. I was
Hmm.
subsidizing it, but I said, even if you pay for it, you'll net an additional $17,000 to each one of the three doctors over the course of a year and provide better care, right?
Mm.
So I showed him that, and I told my whole team, I was like, you know what? Because I'm an economist now as well, right? And I'm not only a scientist, I'm a business person, right? So I said, look, here's when the proof is going to be in the pudding. When we stop subsidizing and funding that transportation program, what do they do? And you know what they did? They all funded it themselves. They decided to actually fund transportation because they saw the value and they saw the economics of it, right? And now many clinics are starting to expand using transportation to actually fill that no-show problem. Because the point I made to these doctors, you're getting paid an average reimbursement of $120 for that encounter, even if you spend $20 on transportation costs.
Yes.
$100 is better than zero, right?
That's right.
So,
That's
and
right.
so, so that's an example of the very first problem we did. The second problem was everything related to pharmacy pre-authorization, right? Because there's a lot of churn in the clinic on, we go to the doctor in the urban setting, they write a script for, a statin when the reimbursement agency or your payer looks and sees and makes sure that you actually had a lipid profile done and looks at your data, and then you're pre-auth to actually get the statin. The problem is in rural, those flows don't happen very well. So then your statin gets rejected, then you got to go back to your doctor, then you have to get the lipid panel, then you got to set it to the insurance. It's all this churn around pharmacy pre-authorization. So we launched a program in pharmacy pre-authorization to eliminate some of those workflow challenges. That's all on the
And
primary care side. And then we did some work on the subspecialty side where we actually use this massive data set that Cerner had donated to us. We've got this clinical data set with clinical data for 63 million patients collected over 20 years. And so the very first thing we
wow.
went to when we went through the surveys, yeah, it's enormous data. It's all clinical data as opposed to claims data, longitudinal. And one of the major challenges we heard back from our primary care doctors was the inability to manage diabetics, right? Not diabetics on their basic blood sugar, but diabetic
Okay.
complications,
Hmm.
retinopathy, neuropathy, nephropathy, because you have none of those specialists.
Right.
So we developed a tool looking at um, we had over 1 million diabetics in our data set. We whittled it down to about 300,000. We developed a predictive tool that we can be able to diagnose, stage, and monitor diabetic retinopathy without needing an ophthalmologist to image the patient, just simply based off their lab data. So now we're actually providing subspecialty care with a technology layer in a rural marketplace. Okay.
Mm.
Now we're going to come full circle. You ready? We're going to come
I'm
back to
ready.
your entrepreneur. You're going to come back to
I'm
your
I'm
entrepreneur
loving
question.
this.
Come back to your entrepreneur question, right? So what do entrepreneurs miss, right? Well, I think they miss on a couple of layers. One is they're looking at urban solutions for urban challenges, but not appreciating where the rural challenges are, right? Number one. So you need to focus on where the rural challenges are, because in the Maslow's hierarchy of needs, they're at a different stack than where the urban challenges are, right?
That's right.
But I'm going to give you hope here. Having backed entrepreneurs for 25 years, sometimes entrepreneurs get stuck in this do loop they can't get out of, right? So they can't get the market adoption because they don't have the data, but they can't get the data because they don't have the market adoption. So they're stuck in this loop they can't get out of sometimes, right? I tell them, I said, don't overlook the urban markets as a place to get your proof points and your start. Because the needs out there, because the problem you run into in lots of times in urban settings is you run against the status quo headwinds, right? You go out to the rural markets, those go away almost entirely, right? And I'll give you two real world examples. One is we just talked about the diabetic
Yeah.
retinopathy algorithm,
Yeah.
right? If I show that in an urban setting, invariably an ophthalmologist in the audience is going to stand up and say, whoa, wait a minute. There's no way you can diagnose, stage, and monitor diabetic retinopathy without me as an ophthalmologist looking at a dilated eye, because we're just looking at the data we are, right? So theoretically, we could eliminate their screening revenue, right? So you're
Right.
facing the incumbent headwinds, right? I show that same algorithm in a rural markets. The primary care doctor's response is, can I get it tomorrow? We haven't seen an ophthalmologist here ever, right?
Yeah.
So you don't face those incumbent headwinds. Second example, Cardia, one of my portfolio companies, the mobile EKG company you see advertised on TV where you put your
Yeah.
fingers on it, it streams your EKG to your smartphone. In the early days of that company, when we would show that tool that we could stream an EKG to a smartphone and then algorithms could diagnose whether or not that patient was an AFib, invariably the urban cardiologists were like, "Whoa, wait a minute. There's no way a device streaming an EKG to a smartphone with algorithms running in the smartphone can diagnose atrial fibrillation." Turns out the FDA disagrees with them because our device is approved and our algorithms are approved in clinical trials at Mayo and Cleveland Clinic and blah blah blah. So but invariably, the cardiologists, because they're all worried about their screening revenue and their revenue, right?
Yeah.
I take that device. We took that device in the rural markets. Their response is, "Can we get it tomorrow?" We have no way of managing a rural AFib patient. Zero, right?
Mm.
So my message to entrepreneurs out there is don't overlook the rural markets as a place to get your start. Now I get where it might be a challenging market to long-term reside because of the fragmentation and the sales channel problems. But in terms of getting started, the need is so great out there, and you don't face those incumbent headwinds like you do in an urban setting. Boy, don't you wish, aren't you glad you asked me one question and you just got a
This is
12-minute
great.
answer?
I think, yeah, yeah, but the way you weaved in and out though was just masterful. So again, you're just like spellbound. You're like, oh, okay, please give me more, give me more, give me more. I know, and I know we're kind of coming up close to our time, but I'm just wondering, I mean, how do people get more of you? How do they follow your work? And obviously here, we're helping spotlight some of it and shining the light on it.
Hmm.
But how do we regularly kind of get more of Dr. Paiva?
Well, I appreciate you asking. I got a near-term solution and a longer-term solution for you. How's that? So
Let's do it.
near term, you can follow me on social media. Our center is on LinkedIn. You can find us at the Center for Health Systems Innovation for Oklahoma State University. You can find that in our LinkedIn. You can connect with me via LinkedIn directly, uh, as well as through my venture side on Twitter and I guess now X. You can follow me at Paiva VC or Venture Capital Paiva VC. So there's all sorts of channels there. Um, the second is I'm in the middle of writing a book about my 25 years of my life journey. It's called My Life in the Middle Seat. And it's all about how to build your personal and professional mindset for success, right? And that's why I use flying in the middle seat on the plane as a metaphor because nobody likes to fly in the middle seat. But I tell everyone you want to fly in the middle seat because think about it, you just doubled your optionality. You
That's
just
right.
doubled your chances you're going to meet somebody that'll change your life personally and professionally. And more importantly, when you do sit in the middle seat, have your heart and mind open to it because it's not just about sitting in the middle seat. It's about having your heart and mind open to it and having these wonderful and engaging conversations with people that you never know where they're going to go. And I can point to a number of examples of times where just the simplest conversation with somebody changed the arc of my life. And so, once the book gets finalized, I'm hopeful to have it out by September's my new goal. I originally thought I could get it out by June, but I don't think I'm going to get it out by June. But my goal now is to get it out by the 1st of September.
We
And
might have to
I
have
plan to
you.
launch.
Might have to have you be a boomerang. Might have to come back and talk about that specifically. Obviously, the door is always open for that.
Yeah, no, and I'm very passionate about those kinds of things about life as well because it's all intermeshed together, and it's all uh, intermeshed together. The one thing I'll tell you about Michael because I actually had this conversation with somebody this morning. Somebody was actually talking to me and they're like, William, look, you got your full-time venture job. William, you got your center. Sounds like a full-time job. Third, you're writing this book and you're launching this speaking company. That sounds like a third job. Like, how do you think about work-life balance? And I said to him, I said, honestly, I don't think about work-life balance. And I'd never had this kind of thought process. And in the middle of this podcast, it came, or in this conversation with him this morning, and I'm going to share it with you with this podcast. I said, I don't think about work-life balance because the reality I think everybody that talks about work-life balance is in a job that they actually don't want to do, right? And
I think about work-life integration. It's all somehow all interconnected.
100%, right? And so I tell people like, here's the thing. If you can find three things for your life in your career, if you can find all three of these things, you're going to be happy. First off, let's digress for a second. I think the worst advice we give to young people right now is go find your passion and pursue it. Worst advice ever, like literally the worst. Because it takes more than passion, right? I'll give you an example. My daughter, I love her to pieces. She's, wonderful. My daughter's 5'2", and if her passion was to play in the WNBA, it's not going to happen. Sorry, I don't care how passionate it is. It's just not going to happen, right? It's just not, right? Maybe not, but it's a very rare, unlikely event, right? So it takes more than passion. So what are those things it takes? I tell people three things. You need to find something you're really good at, find something you enjoy doing, and find something that you can make a living that's commensurate with whatever your life expectations are, right? And if you can find those three things, then that Venn diagram will point you to a life that will lead to a passionate existence, which is different than finding a passion and pursuing it. It'll be a passionate existence. So find something you're good at, find something you enjoy doing, and find something that'll make you an income that's commensurate with whatever you need.
Listen, William, that is phenomenal advice. And I'm definitely going to take a snippet of that and just pass it along to people. And I don't think that's like the mic drop moment right there. So I don't think there's any better way we're going to close out this conversation. And if you've tuned in, if you're building something, whether it's a company, a community, or a better way to care, this conversation today, it was a masterclass in how to stay grounded. Um, William, you clearly you don't chase headlines, but you build outcomes, quietly, consistently. Although we might blow up your spot now that you've been on the show because we're kind of a big deal. Just kidding.
There you go.
And you do it with conviction, and I think that's the kind of leadership that's worth listening to. So thank you for just joining us today, for just sharing several of those golden nuggets. Really appreciate it. So I'm looking forward to more discussions with you.
I'll take you up on your offer to come back when the book's done, and we can have a separate discussion about life and the, how do you maximize your personal and professional mindset for success. Is that
Amazing.
a
We're
deal?
doing it. 100% deal. You heard it.
Great.
All right.
Thank you.